Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, a large study published on November 12, 2017 in the journal The American College of Cardiology has shown that a new dietary approach to lowering high blood pressure can outperform the blood pressure lowering effects of some high blood pressure medications. Now, that's not to say that high blood pressure medications are not important, but researchers point out that doctors should really put more emphasis on proven dietary and lifestyle strategies to lower high blood pressure in their consultations with patients than is often the case in sort of daily practice life. So the 2017 study involved more than 400 patients that had sort of stage 1 high blood pressure, or stage 1 hypertension as we call it. They put half the participants on the DASH diet, which I will explain shortly, and the other half ate the typical North American diet, high fat, refined sugars, high sodium. Participants in both groups were also fed low sodium, medium sodium, or high sodium in sort of random order over 4-week periods. So the low sodium regime was 1,500 milligrams of sodium per day, and the medium sodium regime was 2,300 milligrams of sodium a day, about as much as you would get in 1 teaspoon of common table salt. And then the high sodium regime was 3,450 milligrams per day. So remember that an intake of about 1 teaspoon of common table salt, 2,300 milligrams of sodium, is the maximum level of sodium intake recommended by the U.S. Food and Drug Administration. And keeping levels below this value is thought to reduce the risk of heart attack or heart disease and stroke. But here's what this study showed. So compared to individuals who ate the typical high-fat, high-carbohydrate, high-sodium North American diet, the individuals who followed the DASH diet along with the low sodium regime, so they had 1,500 milligrams a day of sodium or less, showed a significant reduction in their systolic blood pressure. In fact, the higher the initial blood pressure was, the greater was the reduction following the DASH diet with low sodium. In one subject who had an initial systolic pressure of over 150, we saw a drop of 21 points in just 4 weeks. Now, most of the participants saw a drop between 5 and 10 points during the 4-week period, which is extremely impressive when you consider the fact that in order to get a drug approved to lower blood pressure, it has to lower blood pressure by at least 5 points. So here you have a dietary plan that lowers it on average 5 to 10 points in just 4 weeks. And so you have the diet outperforming some of the drugs. Even the most effective high blood pressure lowering medications lower systolic blood pressure by just 10 to 15 points on average. So what is the DASH diet before we go any further? Well, the DASH stands for Dietary Approach to Stop Hypertension. So the diet emphasizes fruits, vegetables, whole grains, non-fat and low-fat dairy products. Now, the dairy products are in there because the calcium dairy products actually has been shown to help lower blood pressure, helps to flush out sodium, in fact. And also lean meats are on the diet that are low in saturated fat and trans fat. So that means eating more chicken breast, turkey breast, having a lot less red meat and pork products. So one researcher stated, what we're observing from the combined dietary intervention of the DASH diet with low sodium is a reduction in systolic blood pressure as high as, if not greater than, that achieved with some prescription drugs. He goes on to state, our results add to the evidence that dietary interventions are as effective as, or more effective than, antihypertensive drugs in those at high risk for high blood pressure, and should be a routine first line of treatment option for individuals, according to Dr. Stephen Juraschik, who's an MD, an adjunct assistant professor at Johns Hopkins University, and an instructor of medicine at Harvard Medical School. So the point of the story is this. Individuals with high blood pressure or pre-hypertension can do a lot for themselves through more prudent dietary practices, the principles of the DASH diet, and lowering their sodium intake, and weight reduction if necessary, and more endurance exercise, and using certain supplements that have been shown to lower blood pressure, like coenzyme Q10 and hawthorn and calcium, and also using meditation or yoga or progressive relaxation therapies. All of these things combined together can help to lower blood pressure in a significant way. So for patients whose systolic blood pressure is at or below 150, for these people, these types of lifestyle therapy should be the first line of therapy attempted, or they should at least complement any drug therapy. Now, things get more complicated if the patient is a diabetic or they have other health complications where blood pressure medications are absolutely mandatory. But even in these cases, the diet and lifestyle strategies that I've explained here should be included in the overall management to help further reduce high blood pressure and improve other really important health outcomes. So I've included a link to the research below, including a link to the DASH diet itself. So thanks for watching, and I'll see you next time.